Assalamu alaikum. I hope you're all doing well. I am Dr. Muhammad Ali Rabbani and I will be your guide in this series of lecture that is on the gross anatomy of upper limb. This video comprises of a very brief account on the organization of the upper limb. As you might have already discussed in the general anatomy, that while discussing the subject of anatomy, while discussing the subject of gross anatomy by regional approach, we divide the body into different parts, including head and neck. We can take them separately: the thoracic region, the abdominal region, the pelvis and perineal region, and then there are two appendages that in humans are called upper limb and lower limb. So this series of lectures will be focused on the anatomy of upper limb. Upper limb, as you have already know, in humans, it is designed for free movement and manipulation as you move around, grip different things. So you have to keep this thing in mind, that it will have the functions that specialize itself for and high mobility and grip and all these other functions. When talking about the upper limb, it can be divided into different regions, but we will divide it into further four regions. This is a picture from Keith Elmore's clinical anatomy. Like, this is the tip of the shoulder, this is the deltoid region. On anteriorly there is a pectoral region. Between them there is deltopectoral region, but behind them there is scapular region, and inside this area this is the axillary region. So we study them generally under the umbrella of shoulder region. So we will be discussing these in the like deltoid region, deltopectoral region, clavipectoral region, pectoral region, axilla, scapulary region. We will all be discussing them as a one major region, that is shoulder region. Then there is a region between the shoulder joint and all the way between to the elbow joint. Here it is marked with this number 6 anteriorly and this number 7 posteriorly. This is basically the arm region, or anatomy. In anatomy, we use the word frequently, that is brachium. Then here is the dividing point. This is the dividing point between arm behind and forearm in front of it. So this is the elbow region, and this is the forearm between your elbow and your wrist joint. This is the forearm. Here on the number 10 and 11, these are labeled the anterior and posterior aspects of the forearm. This is forearm. An alternate name that you will frequently see in the anatomy is the antebrachium. This is the antebrachium. See? Then comes the dividing point between the next region, that is the this on the number 12, the wrist region, and apart in front of wrist there is the hand. It can be further divided into the palm region. On the palmar aspect, on the dorsal aspect, there is a dorsum of the hand region, and then there are digits. We count them from in numeric sequence from 1 2 3 4 5, or alternate names are that we use in common language also is thumb, index finger, middle finger, ring finger, and little finger. So these are the different regions that we are going to follow. The approach that I've usually taken by anatomist, and I'm going to follow this one, is that we will start with the osteology. We will discuss the different bones in the regions of the body. Then we will move from region to region, starting from shoulder, going all the way towards hand, and we will close our series by talking about the structures that are common to all, that are mostly the skin, the fascia, and the cutaneous supply, and the superficial venous drainage and lymphatics. These things will be discussed in each of the region, but we will consolidate them in the end, inshallah. This is how our well-toned muscular upper limb is visible in a human body. This is a picture from Netter's Atlas. There can be a lot of things that can be discussed, but I want to bring your focus to a few things. You can find the evidence of your bones on the surface of your body, on the surface. Like this bone, this is the collarbone that you can see, this is the clavicle. It is present just below the scale, no intervening muscle, and it is very prominent in especially the lean people or muscular people. This is the clavicle, and a few muscles that you will see immediately in the next lecture. This will be the muscle. This is the sternocleidomastoid, and there will be trapezius that is making this area of the shoulder. This bulge is being made by the deltoid. This bulge is being made by the biceps brachii muscles. So these are a few muscles that are very prominent and you frequently see. This bulge in the chest region, this is being made by the pec major muscle, and between them there is deltopectoral groove present between them. And the list will go on as we move further. You will see all the other muscles that are present and the tendons that can be felt here. One more thing that I would like to bring your focus to is the superficial veins that are visible in the cutaneous plate. Two major veins. One is this one. You can follow it from here all the way going to the deltopectoral triangle to this region. This is the cephalic vein. You can see it starting from the thumb aspect. It starts from here, goes to the anterior aspect, and then continues all the way till there. Then there is another vein on the opposite aspect, that is on the medial aspect, on the little finger aspect, that is basilic vein. So it starts somewhere here, it goes to the anterior aspect, and here it continues all the way until it enters the arm in the middle of the brachium, middle of the arm. This is the basilic vein. And between these two, here is a median cubital vein. This is the vein you must have seen if you have ever had your blood sample taken or any intravenous injection has been administered to you. In this elbow region, this is the basilic vein. So these are a few things that you will see. You can see the prominence of the shoulder here, uh, elbow joint here. You can see, feel the bones here. We will discuss them, each of them, as we move along. Let us talk about the bones. I will be using in my lectures. This is the model by 3D4 Medical Complete Anatomy by Regions. This is the 3D4 Anatomy, Complete Anatomy. I will be using this in my lectures. So, what are the different bones that are in the upper limb? Let us start here. In the upper limb, we start with shoulder region, the pelvic girdle. It consists of two bones. The bone in the front, that is the clavicle. It joins, you can see, the sternum with the upper limb. This is the pelvic pectoral girdle, clavicle plus scapula. This is the second bone. This is present mostly on the back, behind your ribs, and it gives attachment to the rest of the limb. As you can see, this scapula is not having any bony connection. It, mind you, it I'm talking only about the bony connection. It does not have any bony connection to the rest of the axial skeleton. Only the clavicle is attached to the sternum. So this is the only bony connection the upper limb has to the axial skeleton. Of course, they are very well supported and connecting through the different connections of the muscle. So these two bones, clavicle in the front and scapula in the back, these two are forming the pectoral girdle. These two are forming the pectoral girdle. So we talked about clavicle and scapula. These two bones together, these are called pectoral girdle. We will compare it with the pelvic girdle that is supporting the lower limbs. So this is the pectoral girdle. Next comes the bone of the arm. This is the bone of the arm. You can very clearly feel it in your arm. This is humerus. It is connected to the scapula above and it is connected to the bones of the forearm below. This is humerus. So this is the bones of the arm. This is bone of the brachium. If we follow them below, next comes the two bones of the forearm, two bones of the antebrachium. You can again feel your forearm like this and you can see both of these bones. If you put your hand like this, the bone that is towards the thumb, the bone that is laterally placed, this one is the radial bone. The bone that is towards your little finger, that is called the ulnar bone. These are the two bones. These are the bones of the forearm region or antebrachium. Next come the region of the wrist and hand. So the wrist consists of carpal bones and the hand consists of metacarpal bones and phalanges. So let us see them. The wrist region, it consists of a number of small bones. These are total 8 in number. 1, 2, 3, 4 in the proximal row. 1, 2, 3, and 4 in the distal region. So these four are the 4 in the proximal row, 4 in the distal row. These are the bones of the wrist joint. See, so these are the 8 bones. These are called carpal bones. These are called carpal bones. We will see their names as we move along our lectures. These are called carpal bones. Next come the bones that are present inside your palm. So these bones, the 1, 2, 3, 4, and the fifth one is of thumb that is present in this raised area of the thumb. These are called the metacarpal bones. These are 5 in number. Carpals were 8 in number. Next come the phalanges, the bones that are present in the digits. In the fingers, there are 3: proximal one, middle one, and distal one. So these become 12, and in the thumb region, there are 2. These are 2. So these are all the bones of the upper limb that we will study. Let me quickly revise the 2 bones of the pelvic girdle, clavicle and scapula. 1 bone of the arm, humerus. 2 bones of the forearm, radius and ulna. 8 bones of the wrist region, carpal bones. 5 bones of the hand region, palm and raised area of the thumb, metacarpal bones, and 15 bones in the digits. These are called phalanges. What are the joints? Just discuss, let's see the names of the joints which are formed between these different bones. This is the clavicle. This is the only bone forming any bony connection to the rest of the axial skeleton. So the joint between clavicle and scapula. No, I'm sorry. The joint formed between clavicle and sternum. This is called sternoclavicular joint. Next, let's follow this line. The joint between clavicle and scapula. The scapula further consists of multiple parts. This raised part of the scapula, this particular part of the scapula, I'm talking about this one that is joining with the rest of the clavicle. This part is called acromion. So this is called acromioclavicular joint. Now the scapula has different parts. This part, this socket for the ball of the humerus, this socket is called glenoid fossa. I will again talk about it in detail. And this is the humerus. This is called glenohumeral joint, or in simple terms, shoulder joint. This brings us to the next of the elbow, the present in the elbow. This is the elbow joint. It is present between humerus above and both radius and ulna below. This is elbow joint. You can see, apart from joining of humerus with radius and humerus with ulna, these two bones are joining with each other also. So this is called radio ulnar joint. So this is radio ulnar joint. There are two such joints present. The one that is present on the superior aspect, this is called superior radioulnar joint, and the one that you will encounter on the lower aspect, like you can see here, here the connection between these two bones and right here. So this is called inferior radioulnar joints. Next come the joint between the radius above and carpal bones below. This radiocarpal joint is simply known as wrist joint, or otherwise it's also called radiocarpal joint. We will take the simplest term. This is joint, wrist joint. All the joints that are present between alternate carpal bones, these will be called carpal joints. The joints that are present between carpal bones and metacarpal, carpal bones and metacarpal, these will be called carpometacarpal joints. The joints present between metacarpal bones and phalanges. Metacarpal bones and phalanges. These will be called metacarpophalangeal joint. And the joints present between alternate phalanges. These are all called interphalangeal joints because they are present between two phalanges. And as there are two such joints in the digit, so this one will be called nearer to the body. This will be called proximal, and the next one will be called distal interphalangeal joint. So this is a brief overview of the osteology that you're going to see in the subsequent lectures. So that's it. I will see you in the next lecture that will be on the osteology of the clavicle. Thank you so much for listening. If you have any questions, suggestion or feedback, please do mention in the comments. See you in the next lecture. Allah Hafiz.